So this is the video that accompanies episode 16 of the Heavy Lives of the Helmet podcast, where we're talking about securing pediatric endotracheal tubes. As you'll see demonstrated, we're showing you with a 4.0 ET tube that a pediatric bougie will pass through the ET tube normally. And then we're also demonstrating with the Thomas tube holder how, if not careful, we can actually decrease that lumen size, increase our airway resistance by clamping that ET tube. That's demonstrated obviously by the inability to pass the bougie. So this is to demonstrate with the taped method how this preserves the internal lumen of the ET tube. Starting out with two pieces of tape here. We are going to split them down the middle, leaving an inch or so intact. Now, you may have seen this used with one long piece of tape. Sometimes this is referred to as the lasso technique, and the piece of tape goes behind the patient's neck. There are pros and cons of that technique. One of the pros is that it is a very secure way to secure the endotracheal tube if that tube is tugged. Obviously, that tape is pulling on the back of the neck, and it's going to prevent it from being dislodged. Some of the cons is that it can inhibit vascular return and increase ICP. So either technique that you use, if you're using two pieces of tape or one long piece of tape, you're going to take one of those strands that was split. You're going to wrap it at the top of the lip, avoiding the nasal septum to ensure that we don't have skin breakdown and avoiding blocking the nares. We're going to go around the endotracheal tube once and then secure to the other side of the face. Now we're going to take another piece of tape and repeat the procedure with one of the strands. As you see, we're using the bottom piece of that strand. We're going on the top of the lip, again avoiding the nasal septum, avoiding blocking the nares, and wrapping around the endotracheal tube. This time we're going to go around multiple times to ensure that the tube is very secured with the tape. One thing that is not demonstrated particularly well in this video is ensuring that someone is helping to ensure that that endotracheal tube is being held in place at all times. This really should be done with two providers to ensure that takes place. So the next step is to take the first piece of tape, the remaining leg of that tape, wrap it around the endotracheal tube multiple times again, and again secure to the other side of the face. The final step would be to take the remaining strand, wrap it over to the other side of the face without going around the endotracheal tube. This helps to secure all the other pieces of tape in place. It helps to make the procedure look neat and tidy. You can trim any pieces of tape that are too long. And here this demonstrates how this can secure the tube well.